Hi everyone, welcome to the Happy Hormones podcast with Moom. Today's episode features Dr. Sharan Kaur. Dr. Sharan is an endocrinologist based here in Malaysia and has been practicing medicine for over 23 years. She's extremely passionate about the subject of women's hormones and really dives deep in this episode into what PCOS is, the various symptoms that happens with it, and also how to best overcome it. It's a really educational episode and I hope you enjoy it. Okay, hi everyone. Thanks for joining us today. I am Maya and I'm joined today by Dr. Sharan. I'm so excited about this conversation for selfish reasons, of course, because I have PCOS and I love talking about it. But also because when I first stumbled upon Dr. Sharan, I was just so amazed by obviously the brain that you have and the knowledge that you have, but most importantly, the way that you present the knowledge you have. It is so easy to understand. It makes you so excited about a woman's body. And I think that I'm just very excited for you all to get a taste of what I have had with Dr. Sharan. So thank you for being here.
Thank you so much, Maya and Moom Health. Thank you so much. It's such a pleasure. Shall we begin?
Yes, we shall. Before we get into the main topic of today, which is going to be PCOS, I did want to ask you a little bit about not necessarily your full background and your medical history in terms of like the studies that you've done, but specifically how you got so involved in the women's health space and how you became so passionate about the PCOS space as well.
Beautiful question. Obviously, I'm a doctor.
Yes.
Okay. Not a master's holder in the sense that it's not a PhD holder, but yes. Been doing medicine for the past 23 years. I started with the whole shebang, okay, the whole medicine, the ONG, the medicine and all that. Well, what happened was when I was in the psychiatry department, I noticed there were a lot of women coming in with depression. But the depression I noticed was always just before their periods or at their mid-cycle.
Yeah.
And then I also noticed that they were always having some sort of problems with their periods. It could be either prolonged or not at all. And from there, I noticed that when I would do a hormone profile, it was either they had a problem with their estrogen and progesterone or their testosterone was just too high and their thyroids were all whacked out.
Yeah.
Now, I realized that I had PCOS when I was 36.
Wow.
Yeah. 2 babies after.
Wow.
At a whopping weight of 125 kilos.
Wow.
Undiagnosed because I don't have multiple cysts.
Yep.
So everyone thinks PCOS, you must have the classic symptoms of multiple cysts.
And we'll get into what that all means.
Obviously, yes. Which obviously I didn't have.
Yeah.
And with my second child, with my second pregnancy, when I developed gestational diabetes mellitus,
Yes.
yet again, no one told me I had PCOS until I learned about hormones.
Wow.
And that's how I got into it. And that's why I'm very passionate about anything to do with hormonal imbalance and anything to do with PCOS.
Yeah. I mean, it's interesting that it almost was sparked, like your medical interest in it was also sparked by your own experience, which
Exactly.
I hear a lot of doctors in this space, oftentimes it comes to that, which is also a sad thing that you don't necessarily learn as much about it as you would like in traditional medicine. But we are going to be deep diving into PCOS today. I was actually diagnosed when I was 15 years old, so very different story than you, and have always just been passionate about learning about it. But for everyone out there that doesn't even know what we're talking about right now, what is PCOS? What does it stand for? And what are the most common symptoms people might see?
I'm going to use a phrase, PCOS in a nutshell.
Yeah.
Because otherwise it's going to be taking days for this. It's a very common hormonal imbalance seen in women in the reproductive age. Now, that's what you see on Google, all right? But for as long as you have your periods and they are irregular in some form, then yes, it's a very easy diagnosis of PCOS.
Yeah.
Yes, of course, everyone says it's 1 out of 10. But what I'm seeing now, how I diagnose it, I believe everyone has PCOS unless proven otherwise.
Which, that is a crazy thing to think about. And it's interesting. I feel, even after we started Moom and I shared a little bit more about my story, it does feel like it's just so much more common today.
Exactly, yes.
Do you think that is an educational level reason? More doctors are maybe understanding it? Or is there something going on besides, what we may think the starting points of PCOS are that is happening to more and more women today?
Well, I think it's also there are a lot of environmental factors to it.
Yeah.
You know, our diet, our sedentary lifestyle, what we eat, what we drink, how we breathe, our air. All these contributing factors are making PCOS from bad to worse. So women who are undiagnosed are coming up to doctors or getting scans done. But sadly, in the medical industry, it's like I said, all about multiple cysts. But there are 5 types of PCOS.
Yes.
Not just one type.
So let's pause and actually get into that for a second.
Yes.
Can we quickly go through the 5 different types of PCOS?
Definitely.
And what those mean?
The commonest being insulin-resistant PCOS, where someone is going to end up with high insulins, prediabetes or diabetes when we look at a blood test called the HbA1c.
Okay.
The second one is known as inflammatory PCOS. We call it the aches and pains. So whoever who has pains, it doesn't mean just headaches or migraines. It can be any sort of fleeting pains. It could be gut issues, right? I get up in the morning, I'm in pain. I sleep, I'm in pain. So that would be 2 inflammatory markers known as ESR, erythrocyte sedimentation rate, and also the CRP, the C-reactive protein. The third one, the most commonest that I see now, is due to stress, the adrenal PCOS. So stress-driven. So a lot of us say, oh, I don't have stress. I'm doing it all. Mind, body, soul, I'm great. We look at the cortisol, it's either crashed or whacked out or really high. So they go into either adrenal overworked or adrenal fatigue. The fourth one, post-pills. So whoever who's been taking long-term birth control pills, oral contraceptive pills, morning after pills. And that also does correlate with high testosterone, known as hyperandrogenism. And the fifth, the latest in the market of PCOS, lean PCOS. So you do not need to be of a certain size or shape. The skinniest I have seen is a 37-kilo lady.
Wow.
Every day in pain. She just gets up in pain.
Chronic pain.
She sleeps in pain. She's so inflamed and she's lean.
Yeah. I mean, speaking of like the lean type PCOS, I was diagnosed when I was 15 years old, by no means overweight. I did have a lot of the other common symptoms, which maybe we can backtrack a bit and get into those common symptoms. So for me, I had irregular periods, and I didn't know what PCOS was at the time. I had super irregular periods. I had a lot of facial hair at a very young age. My hair was very thin on the top of my head. And I just had felt like a lot of fatigue at a very young age for no reason. And it wasn't a weight gain issue, anything like that. And so I went to the doctor, and I ended up getting a scan on my ovaries, and I did have cysts. So I was kind of like a classic patient in that way, but I didn't have any of the weight gain. And I was immediately put on the birth control pill, and we can go through that in a whole nother podcast episode, everyone. But those are some of the symptoms that I was told. I was never told about 5 different types of PCOS. I was just like, oh, you have polycystic ovarian syndrome, take the pill, all your troubles will go away. And I know a lot of our community has heard that story from me before.
Oh, yes, indeed.
But yeah, what are those common symptoms? Like, let's say someone doesn't even know what PCOS is, and they're starting to feel some of these symptoms from the 5 different, I guess, categories that you just mentioned. What are the top symptoms people are feeling that lead them to then say, okay, something is imbalanced?
So the commonest, if we're going to categorize it with the 5 types, the first one being insulin resistant is craving. So you either have a sugar crave, a carb crave, which is carbohydrates, or you're just craving for salt. So you want to grab that bag of chips, or you want to take that whole bar of chocolates, and then you're still not satisfied. Why? Because your leptin is all over the place, which is your satiety hormone. So now that's insulin. You can feel thirst. You can have weight gain for some. Not all will have weight gain. Because obviously when you're not doing a calorie deficit, you're doing a calorie excess, you are going to gain weight. And what happens when you gain weight is you end up with skin tags or darkening and thickening in the skin folds. So it's not just your neck. It could be your underarms, in between your groin, just below your bra line.
Wow.
Now that is called acanthosis nigrans, thickening and darkening of skin folds. When that happens, then you already know that the chances of prediabetes is a given.
Interesting.
Then comes adrenal stress. You get up fatigued, you sleep fatigued, or you have a mid-afternoon slump. You just want to grab your pillow, a blanket, and knock out.
Okay.
Tiredness, fatigue. Now you've got your cravings already. You've got your acanthosis nigrans. Then comes hair loss on the scalp. And then you've got hair growth all over called hirsutism and alopecia. Hirsutism, alopecia.
Yeah.
It's bound to happen. Yes, you do have your normal 100 to 120 strands of hair being shed, but it's definitely more than that. Next thing you know, you're like, I can make a wig with the hair that I lost.
Yeah. And that was one of the symptoms I experienced was facial hair as a young girl who was going to an international American school with a bunch of white boys who would make fun of me for it. And that was really tough for me. So I think that was one of the experiences that led me to go to a doctor and say, hey, something seems off here. And I'm Indian, so of course I have hair.
Yes.
But it was a little bit more than most.
The usual, yeah. All right. Because you already were losing hair on the top, right?
Yeah.
So you had the alopecia and the hirsutism.
Yeah.
But what's not talked about, besides infertility, right, is mood disorders.
Yes.
We can end up with depression, some form of depression. It could be seasonal, but we live in a country that's tropical, so there's no seasonal.
Right.
But there is due to periods. You can feel sad before your periods, or you can feel sad after your periods. Then comes anxiety, eating disorders.
Yeah.
So these are the ones that are not spoken about, and they're definitely not on Google because Google have the 5 standard: weight gain, hair loss, hair growth on the wrong places, prediabetes, and infertility. So yes, it will be difficult to conceive if you already have multiple cysts.
Yeah, I do want to talk a little bit, and thank you for sharing. I think that sums up quite nicely. Like, I guess some symptoms people can look out for before, testing their hormones. I know that's a big part of all of this, and we can get into that in a little bit. But I think one of the most damaging experiences I had, and I know a lot of women have when they are diagnosed with PCOS, is they go to a doctor, they tell them their symptoms, the doctor is like, okay, yeah, you have PCOS, and you're never going to be able to have a kid.
Oh, yes.
And I mean,
and it's
for
so
me,
painful.
Right? Yeah, and that's such a hard thing to hear before you even have thought about having kids, right? It wasn't even part of my mindset as a 15-year-old. Like, I had obviously wanted to have kids, but it wasn't necessarily something that I was really, truly thinking about. And I think that's really damaging because it sets this tone for the rest of your life, essentially, that you're not going to be able to have kids. But we know a lot of women, you included, that have PCOS that have had kids. So how does PCOS relate to fertility, and how might one sort of solve for that or live their life in a way that is going to allow them to still be fertile?
Now, with PCOS being polycystic ovarian syndrome, please remember that it's a misnomer. So the ones who have the multiple cysts will have issues with fertility, more common than the ones that do not have multiple cysts.
I did not know that.
Okay?
Yeah.
Now, in a medical term, PCOS is also known as hyperinsulinemia, which is high insulin,
Right.
and also hyperandrogenism,
Right.
right? So that's the testosterone part of it. When there is an elevation of the male hormone called testosterone,
Right.
the follicle stimulating hormone, which is the FSH, and the luteinizing hormone becomes flipped. We call that the FSH-LH flip.
Okay.
And that is the cause of infertility,
Okay.
right? So when we want someone to be fertile, or when they want to have a child, or they're trying to conceive, what do you call it? TTC now, trying to conceive? Yeah,
TTC.
That's the new term, right?
What the hip kids are saying
The
these
first time
days.
I heard it, I was like,
TTC.
what's TTC? I know what the WTH, and all that, but I'm like, what is TTC, right? Trying to conceive. Right, okay. So I obviously tell them, go get a scan done.
Yeah.
Look for the string of pearls, not a string of pearls,
Yeah.
but cysts in the ovaries.
Yeah.
Now, when you already have that will definitely have difficulties. You will definitely have difficulties in conceiving unless we are able to flip and one healthy follicle or one healthy egg pops out.
Right.
Right? Now,
But is that impossible?
I've had women who've come to me, because I've been doing this for more than 13 years. We've had natural pregnancies.
Right.
In the sense that when we're able to flip the FSH and LH, the fertility hormones, they're able to conceive.
Yeah.
In fact, I had a patient, no periods for 3 months. gave her a round of bioidentical hormones. She got pregnant. And I was like,
Amazing.
not bad, we can do that now. You know? Yes.
Yeah.
I was like, how did I do that?
Yeah,
And she's like,
wow.
how did you do that, doctor? I said, I don't have a pot here with the brewer's ease
Yeah,
which
exactly.
yeah. So it happens,
Right.
but it's not common. Yeah. So that's the thing. You can try, we can try, but then it's not just about reversal. You have to look at your weight.
Yeah.
You have to maintain a very healthy lifestyle. You have to take your supplements.
Yes, that is a great segue into sort of my next section of, this conversation. I think the hard thing to me about PCOS is that it affects so many different parts of, honestly, being a woman, right?
Exactly.
It can affect fertility, it can affect your looks, it can affect your mood, the way you feel, and all of those things make the diagnosis really stressful. And I know we talked a little bit about how stress can impact everything as well, and we can get into that a little bit as well. But the way that I was sort of told once I did all of my research and I really understood how to kind of combat my diagnosis was it's a mixture of lifestyle, diet, and supplementation and or medication. So I want to kind of talk about those three pillars, if you may, and how that helps one manage their PCOS. So, maybe let's start with diet in general. How does diet play a role in managing PCOS? And what are maybe one or two top pieces of advice you'd have for someone when it comes to their diet?
It is the most important pillar. So you have 3, I have 8 pillars.
Okay.
And the first one does start with diet. And so I tell my patients, or even my friends, if you can't cut down your starch, your carbohydrates, your white sugars, your white flour, and your white salt, then we're unable to solve everything else.
Wow.
Yeah. So it's not just about 5 colors on your plate. It's
Yeah.
not just about cutting out desserts. It's taking away carbs, figuring out what is simple carbs,
Right.
simple carbohydrates versus complex carbohydrates. So yes, you can have carbs, but
Yeah.
you got to have the healthier version.
Yeah. Let's
So-
not demonize anything.
Exactly.
But
So if you're looking at rice, you can have rice,
Yeah.
but choose the right kind of rice.
Yeah.
Remove the starchy rice and take the healthier rice.
Yeah.
So it's simple as that.
Yeah.
Then comes gluten.
yes.
All right. So when there is already inflammatory PCOS, there's already insulin-resistant PCOS, take away your gluten.
Yeah.
And a lot of people, all about this hype about oat milk.
Oh yeah, I know. Oat milk is.
Oat is gluten.
Yeah.
And I tell my patients, oats are not for humans, they are for horses. So that's a take-home message.
Yeah, that's a good one.
Right? When you take away the gluten, take away the dairy.
Yeah.
Cow milk is for calves, not for humans.
Interesting.
This is off, obviously. I can't get breast milk,
Yeah. of
so
course.
I do away with milk.
Yeah.
Take plant-based milk, not oat milk. If you're not allergic to almond milk, take almond milk.
Yeah.
If you're allergic to almond milk, find another kind of plant-based milk. You can do the non-GMO soy,
Yeah.
right? I do macadamia milk.
Oh, interesting.
Yes, so I can't do, sadly, I have inflammatory PCOS as well, and adrenal PCOS,
Yeah.
and insulin-resistant PCOS, so that's already 3. And I believe now it's high testosterone as well.
And you're a mom.
Yes,
So let's
a
not
mom to
leave that
2,
out.
yes. And I take macadamia milk with my smoothies, with my plant-based proteins.
Yeah.
Yeah, so I always tell my patients, take away carbs, take away whites, take away gluten, take away dairy. Start with that.
Yeah.
That will be your foundation.
Yeah.
And then from there, we figure out what to do next.
I think it's interesting too, as how PCOS can develop over time. I have recently found that I never really gave into any of these fad trends like oat milk and no gluten and no dairy, but I've recently figured out that I do have some sort of intolerance to gluten,
Right.
and I
Yeah.
was eating it not too often, but every now and then, and I would take my de-bloat supplements afterwards, and I was like, why am I taking this so much more frequently than usual? Because I'm getting so bloated after eating gluten. And
Exactly.
it's something that I've now developed, and I think staying away from it has just helped me feel more energized throughout the day, just overall a lot better. But anyways, that's on the diet side. So I think that's quite simple for someone to understand. From a lifestyle perspective, We can go into your 8 pillars, but we can start with my second one, which is lifestyle.
Yes, definitely.
How does that play a role?
It's a really big, huge pillar as well, next to the diet. Lifestyle means the first thing is being active.
Right.
Okay, that's when the exercise comes into place.
And what does being active mean?
Being active is not all about 10,000 steps.
Okay.
Okay. Yes, we want to try to do the 10,000 steps, but that's just cardio.
Yeah.
You have to have some form of body conditioning or body strengthening. Do not carry heavy weights, because if you have inflammatory PCOS, you can't carry heavy weights. And that makes you worse. So the next day, your post-workout soreness is worse.
Okay.
Then, of course, you're trying to take an N-acetylcysteine, or you're trying to take curcumin, or you're trying to take omega-3 fish oil, but actually it's just you overcarried. So I tell my patients, strength train 3 times a week. Take a break in between. And the days that you take a break, you do some form of cardio. I just invested on a bicycle that I put in front of my TV now.
Right.
So yes, I don't have time to watch TV, but when I do, I'm cycling and watching something on the days that I don't train.
Yeah.
Right? And you don't have to invest in a gym membership. You don't have to invest with a trainer if you can't afford it. Light weights.
Yeah.
Pick up a kettlebell. Pick up a band.
Yeah.
That's good enough. Or do squats and lunges, stuff like that.
I'm just curious, and again, selfish reasons. Why, I mean, and I've read a lot about this, but why is strength training so helpful for female hormones in particular?
It helps increase the testosterone, the free testosterone, not the dihydrotestosterone where your hair is lost. Okay. It helps regulate your estrogen and your progesterone.
Okay.
It increases your basal metabolic rate, indirectly regulating your thyroid hormones.
Wow.
So we all end up with sluggish thyroids.
Yes.
Okay, if it's not hypothyroidism, it will be thyroid insufficiency. So our thyroids are just sluggish thanks to PCOS, right? So when you do some form of strength training, you build muscle.
Right.
You lose fat.
Yeah.
But you also protect your bone. Because with PCOS, what happens?
Pain.
We age faster.
Yeah.
And we're always in some form of pain.
Wow, okay. That's very helpful.
I hope so.
I know, and I think it's just interesting, right? It doesn't have to be this drastic thing.
Not at all.
It's figuring out how to incorporate little changes into your life that are really going to help your overall wellness. And I think at Moom, we always say, like, we want wellness to be accessible. Speaking of Moom, I obviously want to hit on the third pillar to me, which is supplements. And the reason that, you know, I wanted to talk about this is not only because I own a supplement brand, but also because...
I know your brand.
Yes, and we have it right here.
I take it.
Because it really did change the trajectory of my PCOS. As I mentioned earlier, I had super irregular periods pretty much from the start of my period journey. And then I was put on the pill, so I was having a faux period pretty much. And then after I got off the pill, it took me a really long time to get my period back. I was on the IUD for a while as well, so I've really played around with different things. And when I started seriously taking my supplements, and specifically inositol, I think was the one that I saw the most improvement was, my period has completely changed. It used to last up to 2 weeks at a time.
Oh, wow. Okay. And that's prolonged.
It was really crazy. Or it wouldn't come for 3 months. Or when it was coming, you know, every other month, it would last over a week. It was super heavy. I would get really bad cramps. And ever since I really started taking inositol properly, I actually get my period every month. And that was a huge win for me. So I guess let's talk a little bit about supplements, starting with inositol. Why is inositol this magic supplement for PCOS?
I never had that problem with my periods.
Okay.
Right? So I never had irregular periods. I've just turned 50 and I still have my periods.
Interesting.
So thank God I'm not going to menopause anytime soon. Okay? Phew. All right. Now, we all have inositol in our body.
Right.
Right? There are actually 7 types.
Yeah.
Right? And it's also a sugar ester.
Yes.
But the sad thing about PCOS is it's not found in abundance.
Okay.
So because we lack it, if we substitute it, or we replenish it, or we supplement it, what I would say is the FSH that I was talking about gets balanced.
Okay.
And that FSH and LH has a direct link with your menstrual cycle,
Okay.
right? Now, of course, inositol that we're talking about is the D-chiro and the myo-inositol, right? And it must be in a balance.
Yes.
Now, when you have it in a balance,
Yeah.
it regulates your testosterone. So you do not have a spike.
Okay.
When you do not have a spike, the FSH and LH that is flipped low-high unflips.
So it's almost like an equalizer.
Exactly.
Okay.
Exactly.
Yeah.
Your bass and your treble
Yeah.
is equalized. And that
Interesting.
regulates your follicle that's in your ovary.
Right.
Right. So again, the pituitary gland releases these two very important hormones called the FSH and LH.
Yeah.
Follicle stimulating hormone FSH and luteinizing hormone LH.
Yeah.
They directly play a role with your estrogen and your progesterone.
Okay.
When your testosterone is really high, your estrogen and progesterone could either be very high estrogen, very low progesterone, or both being very low.
Yeah.
When you balance out that testosterone, bringing it down because of inositol, your estrogen and progesterone is balanced indirectly. Now, it happens for some.
Okay.
It happens for some.
Yeah.
But for the others, they still need help with the progesterone.
Yeah.
We don't give estrogen to women who still have their periods.
Okay.
We cannot give estrogen to women who have their periods.
Okay.
All right. So we end up giving them progesterone, obviously with inositol.
Yeah.
So we try out supplements.
Yeah.
If that doesn't work, then we have to give them something else, of course.
Yeah, I guess like on the supplement piece, it's interesting because I do think with an issue like PCOS, supplementation really does make a difference.
It does. It does.
What are some of, I guess, the top supplements for PCOS? If someone came to you and they said, you know, I have XYZ symptom, I have PCOS, you've diagnosed them, what are the top supplements people should be taking? And why is it that natural remedies actually work for PCOS?
First of all, we lack it.
Yeah.
So once we replenish it, we balance it all out.
Right.
Hormonal imbalance. PCOS is a hormonal imbalance, but it's not all just about your hormones. Supplementing the right type of supplements.
Right.
The top 5, we'll call it the top 5.
Yeah, let's go top 5.
The first one is actually magnesium.
Yes.
Okay.
Which honestly, I think every woman should take magnesium supplement.
Male,
everybody in the world should be taking.
Right now, there's so many pronouns. All pronouns, all types of gender.
True. That's true.
Take your magnesium. There are 7 types of magnesium.
Yeah.
But the 2 most important ones, for the brain, magnesium threonate. And for everything else, magnesium glycinate.
Yes.
Right?
Which we have at Moom, everyone.
Yes. Yes, you do. All right.
Yeah.
Then comes zinc. So for fertility, for the sake of fertility, obviously, and of course for the sake of health, zinc is important. You can take zinc oxide, you can take zinc picolinate. I take zinc picolinate, right?
We have zinc picolinate.
Very good. The
checklist. A+ Moom.
We should have like a board here.
Yeah. Right? We should get a visual up
here.
The
third one, vitamin D3.
Okay.
Yeah. So we call it the sun vitamin.
Yeah.
And the next thing I know is everyone's trying to bask in the sun. Please don't do that. After the age of 20.
I don't know if that's an issue here, though. I feel like people are afraid of the sun in Asia.
They cover.
Yeah.
And then they walk out and there's no sun exposure.
Yeah.
Children are not sun exposed in school.
Yeah.
They're all in 4 walls. We have light like that, okay, but there's no sun. After the age of 20, we do not absorb sun vitamin D3.
Wow.
Yes.
Okay.
So golfers.
Yeah.
Nah, they don't have high Ds. My dad is a golfer, avid golfer. He has very low Ds that I had to replenish him with a 10,000 IU dose.
Wow.
I take a 10,000 IU dose.
And I've heard with vitamin D, it's important to take it in a liquid format.
No, there are many types.
There are many types.
Yeah.
Okay.
You can take a drop, a liquid.
Yeah.
You can also take a capsule. They're selling all types out there.
Yeah.
As long as it's a good type of supplement,
Yeah.
right? Authentic, original, good ones, go ahead.
Yeah.
But it doesn't have to be in a liquid form where you rip it and you take it, or a drop form. I take a capsule.
Okay.
Of course, I take a compounded type with a compounding pharmacy, so I'm able to manage my dosing.
Right.
It also prevents insulin resistance. So whatever we're giving you is always going to help you with insulin resistance. Top 1 problem with PCOS.
Yeah.
Right? That's number 3. The fourth one, inositol. All right? making sure that there are two types with a 40-to-1 ratio.
Yeah, and I think that ratio is really important, which is an interesting scientific thing. That
If you don't have the 40-to-1, throw out your inositol.
Yeah.
The fifth one is very controversial.
Okay.
I tell my patients when they have inflammation or they have any type of pain, NAC,
Right.
N-acetylcysteine.
Okay.
Take it. Find it, grab it, steal it. I don't know what you want to do.
Yeah.
Find the 500 milligrams, take it every night. You are pain-free.
Wow.
So you don't need painkillers when you have your period pains.
Yeah.
We call it dysmenorrhea.
Yeah.
The back pain that comes along, you just feel so lethargic. Take NAC just before your period, during your period, take it every day.
Yeah.
365 days. There's no such thing as, I take it once a week, I take it twice a week, take it every day. All supplements, take it every day.
Yeah, that is a very important thing. I mean, preach.
Yes.
That's the only response I have. Yeah, you got to be
So that's your top 5 supplements.
Yeah, okay.
Without fail. Whatever type of PCOS. Even if you don't have PCOS.
Yeah.
Take it.
Okay, so those are my 3 pillars. I am now very curious because you have 8.
8.
You can just run through them. If you want to share anything about them, I'm sure I'll have questions.
Definitely. So we've discussed about diet. We've spoken about lifestyle, which is we only touched on exercise, right?
Yes.
So obviously healthy life means healthy living. Eating right, drinking right. So hydration is important.
Yeah.
Right? That is also based on your body weight. So there is no 8 glasses per day. If you're slightly on the bigger side, follow your weight. Just take your weight in kilos and times it by 33, and that's your minimum requirement in ml per day. If you work out, you add on more. And if you drink coffee and tea, you need to hydrate more because they are diuretics.
We did just launch an electrolyte, so I should have brought that for you.
Hydra 8.
Yes, Hydrate.
Yes, I saw that on Instagram. All right. Then comes smoking less, obviously.
Yeah.
Then comes alcohol intake.
Yeah, okay.
Right? So beer is actually a big no-no. Because it actually messes up with your estrogen. Yeah.
Okay.
Right? So just drink wisely.
Yeah.
That's what I say.
What about coffee?
Oh, no.
Oh, no. I don't want to know this because I love coffee.
If you're speaking about experience, I'll just tell you something in a minute. I used to drink so much of coffee that I didn't know what water was.
Oh, my God.
And then when I finally realized that I had PCOS, I have not touched a drop of coffee, caffeine, matcha, or green tea. In fact,
no caffeine at all?
No caffeine at all.
Oh my gosh. I'm amazed. I can't do that.
I've done it.
That's
and I tell,
amazing.
and then when my patients say, "Oh my God," I say, "Yeah, walk the talk."
Yeah, it's true.
It started when
I don't know if I can do that, Sarah.
Exactly, right? Yeah. So decaf it, girl. That's it. Just decaf it.
Yeah,
first.
I mean caffeine. Okay, well, coffee is addictive, 100%. I'm fully addicted to it, and I have become more addicted to it than ever recently because I just love it in the morning.
It messes up with your cortisol.
Yes, which I'm sure is another pillar.
Yes, you know, so you need that pick me up because your cortisol is low.
Yeah.
Right. We have very high cortisols in the morning, and then it plummets down all the way in the evening, and that's how we're able to sleep at night.
Right.
Right. So feeling fatigue, having joint pains, craving for sugar, carbs, and salt, headaches and migraines and lightheadedness, nervousness, anxiety, and low moods, they're all due to cortisol. That's when your adrenals go whacked out. If you could do away with caffeine, of course, we all take time. We will go through the withdrawals, right? Don't go cold turkey like how I did it.
This might have to be bleeped out. If our community is going to get so mad, we're telling them not to drink coffee, Sarah.
Go decaf.
I'm kidding. We can leave it in.
But it does mess up with your cortisol. Okay. So I'm 21 years coffee-free or caffeine-free.
Wow.
21 years. Woohoo!
And you have a very busy schedule as a doctor, so
And I don't touch it. I do decaf tea bags now. I found it on Marks and Spencer's, I think. Yeah, and I'm like, oh my God, Punjabi without tea, help.
Okay, wow. Don't know how I'll overcome this one, but Anyways, continuing
Yeah,
on your pillars.
Find ways to de-stress. If it's going to be laughter therapy or cuddle therapy, or take your dog or a cat for a walk. You can't walk cats, but take your pet for a walk maybe.
Yeah.
Or find ways to do some form of breathing exercises or meditation. Whatever helps you with de-stress. Good sleep.
Yeah. Yeah, actually, sleep is a huge...
And that's why the magnesium glycinate comes into place, right? So if you can't sleep well, take magnesium. You can increase the dose, but if you have loose stools the next day where you're having a bit more looser poo or loose stools, then back off the dose. You can start at 200 milligrams. You can go all the way up to 1,000 milligrams. There is no danger to it. There are no side effects to magnesium.
Yeah.
Except the next day where you go to the toilet more often, right? So good sleep, 7 to 8 hours. Minimum requirement, 7. Some of us need more. So do your 8, do your 9, but don't overdo it because then you are fatigued when you get up.
Right.
Because you've overslept.
Yeah.
Right? But gadgets, try to go gadget free.
Yeah.
So electronics, I know everyone's smiling. Okay, I see it. Yeah. Try to go gadget free.
As we all have our gadgets in front of us. That's fine.
If you could do it once a week, even if it's about 6 hours, start somewhere.
Yeah.
Don't take your phones or anything that has an internet connection to bed. Environmental hazards. We're talking about EMF.
Yeah.
We're talking about radiation.
Yeah.
They do have an impact on hormonal imbalance.
I mean, and that's what you're saying at the beginning, right? These are the reasons that PCOS could be more prevalent today than ever.
Yeah. And then comes your supplements, rebalancing your hormones. If you have an issue with your thyroid, fix your thyroid. If you have an issue with your male hormones, besides inositol, take something to block your male hormones.
Yeah.
If you have an issue with your progesterone, fix it. But you have to see the right doctors to see it.
Yeah.
Do not take a birth control pill, please.
Yeah, actually, let's touch a little bit on birth control pills. It is very, very common for women who are diagnosed with PCOS, even endometriosis, which I'll ask a little bit about at the end, but that they're given the birth control pill as a solution, right? And it usually is given as this like blanket solution that will solve all of your problems. At least for me, it was. What are the dangers of that? Is there any specific reason that happens, that, doctors are so keen to give women the birth control pill? And I guess, what are the harmful side effects? I can name a few that I experienced, but I would love to hear yours.
Why don't you share yours first?
So I actually felt like I developed anxiety.
Definitely.
When I was on the pill. And I actually was on the pill for almost 10 years, 7 years.
And do you know why you develop anxiety?
I have no idea.
Because it suppresses your estrogen and progesterone. You are wiping out all female hormones that are required for healthy living.
Wow.
From head to toe, to start your brain.
Wow.
So cognition, brain fog, poor concentration,
all of those
poor
things.
Motivation.
Yeah.
So these are not side effects that you see in the pamphlet that you get with the box of your pills. You don't see these things, right? But sadly, women who are taking birth control pills is because we were trained and taught in the medical world, in medical school, that is the only solution we had decades and decades ago.
Yeah.
There are changes, but sometimes we don't change with the change.
Yeah.
If you understand what I mean.
Yeah.
Unless you're trained and taught, or you have your own experiences about it. Never once did I ever take a birth control pill.
Yeah.
I don't do synthetic. Except synthetic silk occasionally. Right? So the side effects can range from having acne, bloating, weight gain, moody, cranky, irritable, right? To wiping out your cognition function, wiping out your personality. You become so irritable, you're moody, you're depressed, you have anxiety, because it wipes out your estrogen and progesterone. So if you were taking a birth control pill, and if you do your estradiol, serum estradiol, and your serum progesterone, it will be at the levels of a menopause woman.
Wow.
And you know what happens to a menopause woman? 57 symptoms of menopause.
Right. Hot flashes.
That's not it. Yes, thermoregulation.
That's the only one I know.
But what about itchy skin, dry nails, dry hair falling out.
Yeah.
So all that, we don't have to touch on menopause, but it wipes out all your happy hormones. Progesterone is your happy hormone. That's why women who are pregnant, they've got so much of progesterone, they're happy.
Right.
But the minute they deliver,
it
from
drops.
thousands, it drops down to zero. We end up with baby blues, postpartum psychosis
Depression,
eventually.
Yeah. Wow, okay. I actually didn't know that was the reason. But anyways, just quickly touching upon endometriosis before I ask you my last question. So I did actually ask our community members in the Moom room, which is our broadcast channel, questions that they had for you, a lot of which I've already touched upon, but we do always get a lot of questions about endometriosis. And I don't want to leave that question out because I know it is in some ways similar to PCOS and others not. Can you tell us a little bit about endo and maybe a few tips to help, I guess, support endo? Do a lot of the solutions or managing tools for PCOS also apply to endometriosis? And I know that was a lot of questions in one, but yeah.
Oh, it's okay. I'm breaking it down in my head.
Yeah.
So endometriosis is as common as PCOS because they're actually interrelated.
Okay.
So when I see a patient, I'll tell her, if you have PCOS, the chances of you having endometriosis is also high.
Okay.
Now, in simple terms, non-medical, endometriosis is when your uterus lining, that means the muscle in there, grows outside your uterus. Very simply put.
Right.
Okay? So it spreads out to your ovaries.
Okay.
Right? The highest I have read up is gone all the way up just below the lung.
Wow.
Very rare. Very rare. Okay? But I've read it up somewhere. In one of the journals, there was a publication, and I can't quote it. I apologize for that. But when you have endometriosis, what I have gathered is, because when I do a human profile, I'm looking at an endometriotic patient, the first thing they complain is pain.
Yeah.
Bleeding, excessive bleeding. Then they end up turning anemic, so that's why they're tired.
Yeah.
And the only solution that a doctor would give is birth control pills. The higher grades of birth control pills.
Right.
So they come in feeling horrible, but then the pain's gone.
Yeah. So then they're
But that's all they do.
Yeah.
They're just giving them one solution, but they're not touching all the other pillars.
Right.
So I tell them, work on the other aspects.
Right.
If you want me to take away your birth control pill, I can. But that means rebalancing the hormones that you've lost.
Yeah.
Because a lot of them have very high estrogen, estradiol, and zero or wiped out progesterones. So we just have to balance them. Just balancing it out.
Okay.
Right? As for pain management, I tell them that if you can give your body progesterone, that is already your healer. That's already your pain relief. That's all.
Okay.
And it's as the same as treating PCOS.
Okay.
The 5 types of supplements, the 8 pillars, your 3, my 8. Simple as that.
Okay. Okay, well, I hope that's helpful to people with endo.
Or go see a doctor who knows what they're doing.
Of course. Please, everyone go see Dr. Sharan. I have one last question. And of course, if we have time, we can chat about a million other things. But I wanted to ask, if you could give any woman with PCOS or endometriosis, let's lump them for right now, one solution or one piece of advice, let's say one piece of advice to patients with PCOS or endometriosis, what would it be?
Very tricky. Everyone tends to Google.
Yeah, don't Google. That's honestly sage advice.
See a real doctor, don't see Dr. Google.
Yeah, it's so funny you say that. When Millie and I started Moom 3 years ago and we were writing our about Moom, our first line was, after questioning Dr. Google for years, we decided there was a better alternative because Dr. Google is the worst.
I have a column in my questionnaire. Who were you referred by? Google. And sometimes they don't answer it. And I say, was it Dr. Google? Yes, doctor. I said, okay. And I actually write, referred by Dr. Google.
Oh my gosh.
Not everyone is the same. If you were to look at my 5 fingers, they're all not the same. No woman will have the same similar symptoms. We can link it as together.
Yeah.
Like, oh yeah, I might have this, I might have that. But we're all not the same. What you see on Google or maybe your friends would be different from you. Go seek the right type of help. We all have a problem, but if we don't look for it, we can't find a solution.
Yeah.
This attitude about better not to know, please change the concept of that attitude. Because some of us don't want to see a doctor because we rather not know.
Right.
It will be too late because PCOS is not just about diabetes.
Yeah.
You end up with hypertension, gout, fatty liver, a heart disease, eventually a stroke, and of course cancer. Because without the right type or the right amount of hormones, we end up with breast cancer, ovarian cancer, uterine cancer, and endometrial cancer. So save yourself from all that.
Yeah. Okay,
That's my take-home
to end
message.
on a quick high note, though, why don't you tell everyone where they can find out more about you, see you, find you on Instagram, anywhere? Just please share with the audience.
That you can Google. So you can find me on Instagram,
Yes.
Facebook, I think TikTok as well, but that's personal, and
At Dr. Sharan
a clinic, yeah. So it's just Dr. Sharan with an
Dr.
A.
Sharan Clinic.
Dr. Sharan Clinic, yeah.
At Dr. Sharan
Sharan
Clinic. Is that correct?
With an A, Sharan, not Sharon Stone.
Yeah. But thank you all so much for joining in, paying attention, and listening. I know I learned so much today, and I've already spoken to you a bunch of times, but I think everyone out there has probably learned a lot more. I think my wish is that there are more people like you in the world, and just easy to speak to doctors. It's just so helpful. But thank you so much for coming, and I hope everyone got a lot out of this session.
And September being the PCOS month,
Yes.
I'm so happy that we're creating awareness,
Yes.
which is really important. Thank you so much.
Thank you.